Thank you so much for having us here. I wanted to briefly touch on just two topics. One relates to what happened at the legislative session this last year with respect to our opioid crisis. I think we made some more headway, but I guess if I could get a point across to almost any audience that I get a chance to stand in front of, it's that we have got a long way to go on it. And the other point that I would try and get across, which is a belief that I've come to believe, is that the reason we are in this fix with so many opioid overdose deaths is because of the medical community and their habits in writing narcotic prescriptions. We did not always have this problem. This problem started about 20, 25 years ago, when over the course of 3 or 4 years, the medical establishment as a whole, for reasons that seemed like a good idea at the time, increased the number of narcotic prescriptions by a factor of 5. And with about a 1-year lag, the overdose deaths increased by a factor of 5. And we've been there ever since. We've gathered more data, we've gathered some more tools to try and respond to it, but just looking at the two curves, they just go right up from 1996 to about 2002, and we've been at the higher level ever since. The prescriptions that we write on our prescription pads are just as addicting and have the same effects as heroin, most addicting substance that we have discovered yet, as far as how difficult it is to get people back off of it. And I play this little game. Whenever I get a chance to speak anywhere, I think to myself, okay, how far do I have to go back in my day-to-day life to come across a horrible story to tell? And I don't ever have to go back 6 months. I got 2, one from yesterday and one from 3 days ago. So from 3 days ago, I'm talking in my clinic with a little husband-wife couple that come in. They're in their early 30s. Both of them, when they were late teens, had problems with substance abuse. The husband with polysubstance abuse, opiates. The wife, they didn't know each other at the time, with methamphetamine. Both of them, after about 3 years, to their great credit, got clean. With a lot of work, they get clean. And so then they live the next 7 years of their lives clean as productive citizens. And then 3 years ago, the husband breaks his leg, breaks his femur. Goes in, seeing the trauma team, is basically given, despite the fact that he told them he had a past history with narcotics, is given 2 months of high-dose narcotic, because that's what you need because you broke your leg. Within 2 weeks, he's back addicted. Within 2 weeks, he's back purchasing pills on the street again. His leg has healed up fine, but no one on the team that took care of him bothered to talk about that was immensely high risk. They never really even communicated with him about that. It kind of spun out of control, but by then his leg was better, so not their problem. So not only did we damage him, but in the course of having high-dose narcotics sitting around, his wife gets back addicted as well, too. So now for the past 3 years, they've been using heroin. They're both back not working. They're both back with their lives ruined because no one was paying attention in a high-risk situation. So the other situation is just last evening, I went to a wedding reception where you're standing around chatting to people, and one of my friends there, who also issue is important to him, says his wife just had her ankle, a surgery done on her ankle just last week. And he's an advocate of legalizing cannabis, and so opioid prescriptions make him angry that this much more dangerous substance is easily available. After his wife's ankle surgery, without any discussion, she is given a prescription for 80 oxycodone tablets. Here you go. Here's your 80 oxycodone tablets. She goes home, it takes 1 or 2, they make her sick. They make her nauseated. So she calls back on the phone and says, oh, these are really making me sick. Is there anything else? So, without any discussion, she is given 80 hydrocodone tablets. 160 tablets, just like that, easily enough to become addicted. Sorry, those are my stories, and there's plenty more where that came from. So in the legislature, these are 2 of the bills that I worked on. One of them would require insurance companies not to have policies, but to report on whether they have policies about high-dose opioid or high-risk opioid prescribing practices. Even assuming that you're going to write opioid medications for patients, there's some areas that we know that are really high risk, very high doses, for example, opioids with benzodiazepines, for example, starting a new patient that becomes a chronic patient without paying attention, for example. And in my personal experience as a family physician, one of the main ways that doctors change their habits is when insurance companies put requirements on what's easy and what's harder to do. So my bill doesn't require the policies, but asks them to report. And I do hope that we'll get to the point where our insurance payers say, that's a high-risk proposition. Okay, you can do that, but you're going to fill out a prior auth, where we just make it a little harder to do the high-risk thing and a little easier to do the low-risk thing. The other bill that passed looks at the very first time we give opioid prescriptions, when it's an acute prescription, the person hasn't been on opioids before, and say, if you're writing a new prescription, those first prescriptions shouldn't be more than 7 days at a time. The person's already on them, okay, they're already on them, they're taking them long term. But it does not take very long to get addicted, and so our first prescriptions need to be short amounts at a time. A person can get more if they need more, and we need to be paying attention to whether we're slipping towards addiction. And that took a lot of work. I had to make concessions. I got the bill through. I was very happy about that. I went to the ceremonial signing with Governor Herbert, and the next day after that, nothing really changed, because just to have it on the books as a law doesn't mean that the whole medical community knows about it or pays attention to it, or moves it into their habit. So it's sitting there as a law in the books, but I really hope that over the next couple of years, the additional work can be done to make people aware of it and move towards implementing that and having that as a habit that we follow. And I'll yield the microphone here, or else I'll go on way too long on my next topic.